Good afternoon. Good afternoon, everyone. Good morning, depending on where you are. It's really excited for all of you to join us today to learn more about the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. I'm Lori Zeffrin. I'm Senior Vice President at the Commonwealth Fund of Advancing Health Equity. And this is a key initiative program that we've funded for over 2 decades. For today, if you go to the next slide, today we'll talk about the Commonwealth Fund Fellowship. You'll learn more about it. You'll get to hear from Dr. Joan Reed, who leads the fellowship program, who has developed the fellowship program, and has really guided this entire program from its inception. What's also wonderful is that you'll also get to hear from current fellows and alumni. You'll hear from Dr. Nena Eze, who's a current fellow, from Dr. Nasreen Ibrahim, who completed the fellowship recently in 2023, from Dr. Mary Fleming, and from Dr. Alden Landry, who is an alum and also co-director of this fellowship program as well. Then there'll be an opportunity for questions and answers. Just some quick housekeeping. The chat function is not available and all lines are muted. There will be live closed captioning available as well. And the recording of these slides will be available on the CFF website. However, you will have the opportunity to ask questions usually at the bottom of your webinar screen. You'll see a Q&A box, which you can click on and ask some questions, and we will be fielding those questions towards the end of the webinar as well. So again, thank you so much for joining. We are honored and excited for your interest and really look forward to continuing engaging with you as you learn more about the fellowship and hopefully apply or send to colleagues and friends and family who may be interested in applying for this work. What I want to do is just start out with an overview of the Commonwealth Fund, just tell you a bit about who we are and what we support. Again, my name is Dr. Lori Zeffrin. I'm Senior Vice President, Advancing Health Equity at the Commonwealth Fund. If you go to the next slide, in terms of who we are at the Commonwealth Fund, we're an independent, nonpartisan foundation or private philanthropy. And so we describe ourselves as a think and do tank. We fund research to drive policy and systems change. And we also fund and support the Commonwealth Fund Fellowship in Minority Health Policy at Harvard. This foundation was started in 1918, actually the first foundation founded by a woman at that time. And so we've been around over 100 years. And our mission is to really promote a high-performing health system that provides affordable, high-quality healthcare. We have a special focus on those most marginalized to inequity, including people of color and people with low income. We fund, we spend, we give away about 30 to 40 million a year to fund research, help guide, help inform policy, and really help drive change that promotes a high-performing health system. Our president of the Commonwealth Fund is Dr. Joe Betancourt, who was actually in the second class of Commonwealth Fund Fellows as well, which is very exciting. He's our new president of the Commonwealth Fund. Next slide, we fund and support research in 4 key areas. 1, advancing health equity, on achieving universal coverage, improving how care is delivered, and controlling healthcare costs. We have overall 8 programs that really typically touch on many of these key areas. What I'd love to do is just share with you a little bit about our work in the Advancing Health Equity portfolio, which is we have a portfolio that focuses on advancing health equity, and also our work on health equity is cross-cutting across the foundation, and it's really deeply ingrained in our mission. If you go to the next slide, next slide, please. And in terms of our advancing health equity portfolio, our overall goal is to eliminate unequal treatment, experience, and outcomes in health and healthcare by addressing systemic racism and advancing equity in policy and practice. our 3 areas of focus have been around dismantling racism in healthcare delivery, using policy to bring about equitable access, and also really driving change in culture and beliefs and attitudes around racism and equity across healthcare workers and healthcare systems. And if you go to the next slide, as we think about how in the work that we do, how can we drive policy, how can we drive systems change? You know, we really believe by helping drive payment and policy reform can ultimately help drive change. And that also can help feed into delivery system change. And also really also thinking about community change at the community level, that's also a key lever for change. And so our goal is to use research and work and partner and work with community-based organizations that are really focused on driving equity, driving systems change, and improving and driving a high-performing healthcare system. If you go to the next slide, you can go to our website at the Commonwealth Fund. We have a range of resources that are available that really describes our work and our research from addressing maternal health care, to addressing how health plans can improve collection of data, to addressing women's health, to addressing how Medicaid can further advance health equity in primary health care. Next slide. In terms of some of our work, I'd like to just highlight some of how we're thinking about our work around health policy and health systems. In terms of health policy, really our hope is that our work can drive policy change at the federal and state level, and we can do this either by supporting work that funds research, developing and disseminating tools that are best practices, promoting measures of equity, advancing maternal health equity, and we really curate information and partner with our grantees and researchers to really develop information that is useful for policymakers and healthcare delivery system leaders. We also, if you go to the next slide, our work around health system and communities is really focused on how can we look at impactful anti-racism programs in healthcare delivery systems? How can we better understand the methods that health systems are using to track and adopt equity measures? What innovations are happening that really build collaborations between community and health systems? And also the support of this fellowship, the Harvard Minority Health Fellowship, Minority Health Policy Fellowship is also a key part of this work. I want to talk about two key things. One, if you go to the next slide, some of the work, for example, just give an example of some of the work that we funded. We funded some work with Dr. Ansel and Dr. Battle at Rush as they're building out a racial equity progress report to really hold up a mirror to healthcare systems so the healthcare systems can better understand how to address racial and health equity within their quote unquote 4 walls, looking at either their board leadership, how they provide care to patients, their strategies and analytics, as well as their relationships and with their community. And the goal of this work is to scale it broadly to other healthcare systems as well. And in terms of how the Health Equity Fellowship fits into this work, if you go to the next slide, really this Health Equity Fellowship is an extension of our goals of advancing health equity. Our goal is to increase diversity and health equity expertise in senior leadership positions in health and health policy. And I'm sure Dr. Reed and others will just talk further about just the illustrious alum of this program that are in senior leadership positions in healthcare. And really leading with equity at the center. Our goal is also to help create leaders that can shape the discourse and design of health policy, that can foster systems change, and really increase the dedication of health systems and our communities to improve health equity with a focus on justice. So if you go to the next slide, just want to introduce you to our team at the Commonwealth Fund that's leading our Advancing Health Equity program. And if you have any questions, please feel free to reach out to us. If you go to the next slide, in terms of the Commonwealth Fund, to learn more about our work, reach out to me or to check out our website and resources as well. Well, thank you. I'd love to just take the time now, if we go to the next slide, to turn it over to Dr. Joan Reed, as who's our next speakers, who will provide an overview of the fellowship and the application process. Dr. Reed is the Dean for Diversity, Inclusion, and Community Partnership. I wouldn't be where I am today without Dr. Reed. I'm sure many people can say that. She's really a leader and luminary in this field as well. And then the rest of our speakers are Dr. Nena Eze, as I mentioned, who's a current Commonwealth Fund Fellow, Dr. Mary Fleming, and Dr. Alden Landry, who are alums, and Dr. Nasreen Ibrahim, who's a recent alum of the fellowship. Dr. Joan Reed, thank you. I'll pass it over to you.
Thank you very much. Next slide. So good afternoon, and thank you for that introduction, and thank you for this continued support of the Commonwealth Fund for this fellowship program. I'm going to briefly go over some of the logistics of the fellowship program and then really turn this over to our current and alumni fellows to tell you more about their experiences, and then open this up for questions. And just to start with some of the goals of the program, it's to prepare physicians who want to become leaders that will eventually improve the health and healthcare for what I would call vulnerable populations, historically marginalized populations, the places where those disparities exist across our society. And as we think about this, it's preparing individuals to lead in this space, but also increasing representation of diverse leaders. And as we just heard, representation of individuals who have an expertise in health equity and can add that lens to conversations. But it doesn't just end with the fellowship, it continues, and it's thinking about continued career development and advancement of individuals as they follow their own career trajectory and career path. Next slide. So the Commonwealth Fund Fellowship has been here since 1996, but it's also joined by some other fellowship programs where fellows have learned together, California Endowment Scholars, as well as the Joe Henry Oral Health Fellows. And in total, there's been 162. And this is a summary of what has happened with these individuals. And you'll see that all of them have remained committed to issues of policy and public health and the improvement of healthcare and health systems, issues of equity across the system. But they're in multiple sectors, from the academy to public to private sectors. They publish, they have academic appointments in medical schools and schools of public health. They're very much involved in communication and working with the media. They've won many awards, and we actually now have 3 of our alums who are members of the National Academy of Medicine. They serve on multiple advisory committees at the local, state, national, and even international levels. Next slide. So a brief overview for eligibility for the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. Physicians who have completed their residency and who are now either board eligible or board certified. Individuals must be US citizens or permanent residents. And so, yes, they can have their green card. And we're looking for individuals with evidence of leadership experience and potential to move into leadership positions, and a commitment to historically marginalized populations. Evidence that this is not something that they discovered yesterday, but they have had a commitment throughout their journey, their academic and their career journey. In terms of the benefits for fellows, there is an $80,000 stipend. This is a full-time in-person program where individuals earn an MPH or an MPA. And so the fellowship covers full tuition costs for the School of Public Health, Harvard School of Public Health, or Kennedy School of Government, covers health insurance, books, travel, there's other program expenses, and financial support for a practicum project. But what the fellows might tell you is, and one of the most important parts of this program is the network of fellows and the fellowship of the fellowship as such an important component of this program. Next slide, please. So there's a degree. an MPH from the Harvard Chan School of Public Health or an MPA from the Harvard Kennedy School of Government. And for those going for the MPH, there are two fields of study, so either in health management or health policy. Those individuals who already have an MPH would be the ones who would be eligible to apply for the MPA from the Kennedy School. There is cross-class registration, so that classes can be taken at other schools, such as the Ed School or the Business School or the Kennedy School. And for the coming year, for this current year, it is not virtual as it was with COVID. It is all in person, and it is anticipated that it will be all in person for next year, although there are some virtual sessions. And you see here part of the course requirements for an MPH. Mostly related to the content knowledge needed for an MPH, either in management or policy, but also some special courses such as the one led by Alden Landry and Leadership in Minority Health Policy. Some special courses that are designed for this fellowship. Next slide. There are leadership forums and opportunities to meet leaders from across the country. There are leadership skills sessions, seminar series, journal club, some special work with op-ed writing. There's a practicum project, a practicum required for the MPH, but a practicum that is also for the fellowship. They are not two separate ones. There's one practicum that accounts for both. Mentoring is provided by faculty, by alumni, by individuals in leadership from across the country. And there are both individual and group meetings among the fellows. They do attend at least one national conference, the Academy Health, but also depending on interests and timing, other conferences are also attended. There's sessions with leadership from some of our Harvard affiliate hospitals, such as Mass General Brigham, in terms of understanding the roles of individuals in these systems and how the work gets done. Site visits, both at the national and local level, local with the health department for the city of Boston, or with our government, the State Department of Public Health, but also national, visiting with national agencies. The shadowing of leaders that are based, with those leaders are selected based on the individual interests and career path that fellows want to take. And there's an annual meeting where current fellows present, but also attended by alumni fellows. Next slide. So when I think about the activities of the fellowship, part of this is a year of reflection. It's building one's own personal narrative, understanding the journey that individuals have taken to get to the fellowship and crafting where they want to go next. Building out their career network that extends beyond the network that they have garnered through their academic training and their clinical training. Fostering systems and understanding how systems work, health systems work, connecting with leadership and policy, and strengthening alumni connections. This is very much about a family and building connections that cross classes of fellows and cohorts of fellows. Next slide. So for this program, the application deadline is December 1st this year, December 1st, 2023. And 2 applications will be required. One to the Commonwealth Fund Fellowship in Minority Health Policy. And depending on whether someone is going for the MPH, they would also have to apply to the Harvard Chan School of Public Health for their MPH program. If they already have an MPH, they would apply to the Harvard Kennedy School Master of Public Administration program. But if you have questions, you see here the phone number for the program, as well as the email where you can ask us further questions. Next slide. And here's just some examples of career paths of the fellows. You can also look on our website and see where fellows have been before and what they're doing currently. And it's illuminating. They're in multiple sectors in multiple places. And you see here individuals who work in the private sector, from WellPoint to individuals who are working in the academy. You see Alice and her professor of clinical medicine, but also a chief health officer, Centene. We see individuals with the federal government, with PCORI and the Office of Minority Health, individuals who are working with other private parts of the private sector, such as Humana, or with the academy, such as Ross and his work with Medical Director of Community Health in the Department of Community Health at the University of Florida, Don Warren, who is co-director of the Center for Indigenous Health and a professor at Johns Hopkins School of Public Health, and Roger King, who's a senior vice president, chief diversity inclusion officer in the state of Maryland. And so you see from the academy to the feds to state government, really across the board, from public to private sector, the kind of career paths that fellows have followed. And if we turn to the next slide, you can see our current fellows. You'll be hearing from one of them. And you see that they come from multiple backgrounds, from dermatology and pediatrics and ID, emergency medicine. Some have been out in practice and have started organizations. Some are coming to the fellowship from having been residents in pediatrics and emergency medicine. And so multiple career stages or levels for entry into the fellowship. If we turn to the next slide, we're going to now turn to the individuals who joined us today to be able to give you their perspective and tell you a little bit about their journey. We're going to start with Nena Eza, who is a current fellow in the Commonwealth Fund Fellowship program. And with that, I'm going to turn it over to you, Nena.
Thank you, Dr. Reed. Good afternoon, everyone. It's a pleasure to be here and tell you about myself briefly, as well as why I chose to apply to the Commonwealth Fund Fellowship. Just briefly, my background, I went to undergrad at the University of Southern California, and it was there I really started to understand and appreciate the importance of looking upstream for root causes for what we were seeing in the clinical spaces. It really inspired me to pursue more training and experience in policy. And so I participated in the Executive Fellowship, which is a program through the Capital Fellows Program, where I was actually placed in a State Department and really was able to understand how government was run. Was really inspired to continue into looking at policy and how that can manifest into outcomes for marginalized communities. So when I matriculated to medical school at the University of Wisconsin, I spent majority of my clinical experiences at safety net hospitals in Milwaukee, and also participated in community engagement programs longitudinally. My clinical interests were really piqued in looking at how do we walk as physicians with patients that have complex conditions. And so I was inspired to apply into both internal medicine and dermatology to really seek a career in complex medical dermatology. Next slide. So just briefly sharing a little bit more about my why. The conditions that I was really interested in working with were people that really struggled with conditions like lupus, sarcoidosis, hidradenitis suppurativa, what have been historically neglected conditions within the field of dermatology. And what I really actually saw was a lot of the patients that I saw in my primary care clinic were actually the same patients that I would see in my complex medical dermatology clinics. They had a lot of complex social and medical needs and were often low-income patients of color. They presented with more severe disease and often had less well-controlled disease as a whole. And I really started to look at the continuum of how a person comes from a marginalized community to how they get to my clinic. And what I've really seen and what has been demonstrated in the literature is that there's a severe limitation in access to dermatologic services in marginalized communities. There's been delays in access and diagnosis related to insurance, and that's been associated with treatment delays and adverse outcomes. And so my impetus of really why I wanted to apply to the Commonwealth Fund Fellowship was to really get the skills and the experience in developing innovative care and payment models that help increase access to dermatologic care for patients with complex social and medical needs. Next slide, please. So it's only been a couple of months, but it's been a super formative experience already. I just brought in a couple of photos just to highlight what I think, like Dr. Reed mentioned, is the most important part of the fellowship, which is really the community of people. I can't tell you the number of conversations that I've had with my co-fellows where we just pontificate about different things within the health equity space, our careers and where we want to go. It's so inspiring to talk with other people who are just as passionate about health equity in marginalized communities as you are. So I have a couple of photos of my co-fellows, former fellows who come to speak to our seminar class. I'm Dr. Kimberly Ching, and it's just been a really great experience. And on top of the MPH that I'm getting in health management, the really nuts and bolts of the program, this is really the special sauce, the people, and really what makes the fellowship such a rewarding experience thus far. So I will stop there and pass it over to Dr. Ibrahim.
Thank you. I just need to share slides. So I just graduated from the program, and I am a heart failure and transplant cardiologist right now at the Brigham. And I'm also the founder and executive of a nonprofit called the Equity in Heart Transplant Project that I founded essentially during my fellowship year. So everyone tells you that your career is just like chaos to get to where you want to be. And I'll share a little bit about my journeys. And I always used to see these kind of slides and didn't believe it, but now I do after going through the Commonwealth Fund Fellowship. I went to undergrad in Cincinnati. I did medical school there, residency. I stayed there for fellowship, and then I finally had to leave. And I think it was just for me comfort in staying in Cincinnati after immigrating to the US from overseas had been such a traumatic experience. But then I went to University of Colorado because there was no transplant program in Cincinnati. So I had to leave. And there was this lady, I call her my fairy godmother. She is the queen of heart transplant. And so I trained under her. And then I didn't want to finish training. So I came to Boston and I went to Mass General. I did a research fellowship and stayed on as faculty actually for a couple of years. And I forgot to add my other institution, which was Innova Heart and Vascular Institute in Virginia. And then I met Alden during this roundtable series that we were doing with the Office of the Vice President of the White House. And I asked if he could meet with me to talk to me about the fellowship, because in my mind, we do great work with just one-on-one care, but I wanted to do something that would impact a much larger population of patients and impact policy. So I met with him and he encouraged me to apply. I was concerned that I was applying after being out of training for a few years, about 4 years. And so that is my fellowship class. It was a chaotic, in a good way, year for me because I had a lot going on, including building a nonprofit and going to class and going to Alden's class without skipping it. So it was a great year. I'm now faculty at the Brigham and I do a day and a half clinical work here. And the rest of the time I work on my nonprofit. And I had interviewed kind of all over, but Brigham was the place that gave me the most protected time and wanted no stake in my nonprofit. So that's why I chose it. It's called the Equity in Heart Transplant Project. And the reason I founded it is because since my fellowship in Colorado, I had seen so many patients being turned down for things that to me, were easily modifiable risk factors, things like stable housing, things like caregiver support, money to get your teeth pulled out before being listed for a transplant. So I always said, based on a few $1,000s, we're letting people die. And I was like, either I'm going to do something about this or I'm going to leave this field because I don't want to be part of the problem. And so that was the impetus for founding the Equity in Heart Transplant Project. So what we do is we address these social barriers. So we help with medication co-payments. If you live in either Georgia, Nevada, or Montana, their Medicaid does not cover heart transplant. And so we found institutions will transplant the patients for free, but then their medication co-payments post-transplant are not covered, and the patients are expected to raise around $10,000. You can Google CNN wallet biopsy, and they talk about this $10,000 requirement that you're asking somebody a lot of times on their deathbed, maybe living in a mobile home, and their circle of friends, their social network is probably not worth Bill Gates' money, and you're asking them to raise $10,000, which a lot of people can't do. We help with housing and transportation. There are patients who get turned down for transplant because we don't want you riding public transportation when you're immunocompromised. So if you don't have a car or a person that has a car that's willing to bring you to your millions of appointments after transplant, that's a reason people are turned down. And then finally, any unmet needs, because you're expected to have a caregiver. So if I need a transplant and then my partner becomes my caregiver, who's going to take care of maybe small children? So we help with childcare costs as well. So we started taking applications for assistance September 2022, all summer while I was taking my biostats classes. I was doing all this, paperwork with my attorney, doing the first few fundraisers to get us off the ground. And then we had enough money from a birthday fundraiser I did in July, where a couple of my Commonwealth Fund Fellowship classmates were in attendance. We raised $10,000 just by telling people to not buy me gifts, but just donate to my nonprofit so we can get it off the ground. And since September 1st, 2022, we've helped 25, if that number is wrong, because we just accepted our 25th patients. We've helped 25 patients in the US get listed for transplant. The most recent patient, he is an undocumented immigrant from Mexico. San Diego UCSD agreed to transplant him, but he needed to move his family closer to the transplant center because he lived closer to the Mexican border. And so Medicaid in California is one of the best in the country because they cover undocumented people. The doors have just it's like almost just crazy, the doors that have been opened because of me being part of this fellowship. I always share this, and I texted Alden when this happened. I don't know if I'm blocked, Alden, because I always text you when cool things happen, but I got this message from this big shot at HRSA or HHS. So she is leading the whole organ allocation system in the United States is pretty terrible, pretty biased, pretty old school. So Congress, the Senate actually wanted to revamp it and dismantle it and rebuild it. And she sent me a message on LinkedIn and said, I heard about your nonprofit. Can we meet? And so I met with her, and it was pretty awesome that she's the one that reached out to me. But it was also pretty crazy to see that a lot of them had no idea what actually happens behind doors and how we select patients for transplant and how much social determinants of health play a role. Other things that we have done with my nonprofit, other than again, it's like a Band-Aid solution, is providing these funds to help patients get listed. We've also been involved in advocacy. So we've provided testimony on 2 different occasions on 2 bills related to CPR. So one is for teaching dispatchers how to, or training dispatchers to coach bystanders to perform CPR. And the other bill is bringing hands-only CPR training to elementary schools. Also, because of my nonprofit, I was invited to testify both times. The first time I couldn't go because I had COVID. And then the second time I was in Vegas for a meeting, so I had to do it virtually. But again, awesome experiences that would have not happened without the Commonwealth Fund Fellowship. Also, Brigham and Women's allows me to do all this, but they say that I have to say that I'm doing it on behalf of my nonprofit, which is amazing. Lastly, because of Alden and Joan's class, the leadership class that you take on Tuesday nights, we got to meet James Corbett. He was one of our speakers, and he told me about this awesome conference in Vegas called Health. And he encouraged me to submit a proposal about my nonprofit, which I did. And I thought I would have 0 chance of getting in, but we got accepted, and I was asked to moderate a session with these CEOs of these really amazing startups relating to cardiovascular care, and their goals, their focus, a lot of them is reducing disparities. And so that's James Corbett, that's Nana, one of the current fellows, and that's just one of my best friends who decided to tag along. On Tuesday night, there was a Fat Joe and Ashanti concert. And then through James, I met 4 venture capitalists who want to donate to my nonprofit and are coming to my next fundraiser. So again, none of this would have been possible without the fellowship. And I will say the lessons learned for me throughout the fellowship and through building my nonprofit is that people would rather pay for a party than cut you a check. So I throw a lot of parties because that's what I love to do, but I raise money. Shoot your shot every time. You should not be afraid to ask for things. And then lastly, that there's a lot of good people in the world. You just have to find them. Every time I tell people about the work that I do, they roll out the red carpet, they provide crazy discounts, and they also just connect me to other people that they think will be interested in supporting my work. So this is a QR code to our website if you want to learn more about us, but thank you. I would not be here without that first conversation with Alden encouraging me to apply, and with Joan, and it was totally worth being broke for a year, because you are broke for a year if you've been attending and you go down to a fellow salary, but it was so worth it.
Thank you, Nazarene. We're going to now turn to Mary Fleming, who is obstetrician, but also president of the Reed Scholars. Mary?
Thank you, Dr. Reed. Good afternoon, everybody. And Nazarene is a hard act to follow. She's done amazing, amazing work. And so I'm here to represent Reed Scholars, which is our alumni component of the fellowship. So when you graduate, you are not done with us yet. A little introduction of myself, as Dr. Reed said, I'm current president, but I'm also an OBGYN, currently working clinically in a travel capacity so that I too can do other things like participate with the Reed Scholars. I also lead a leadership development course in health equity for the Harvard School of Public Health. And I am now Chief Medical Officer and co-founder of a maternal health startup that's based in West Philadelphia. As you've heard from the other speakers this afternoon, this is a family affair. I think we've all shown pictures of our cohort because we love them so much. You really do spend a lot of time with each other, but it's also because you spend a lot of time with people who are really like-minded and, as mentioned, passionate about making the world a better place, literally, and that's what we talk about every day. But also you're able to talk about opportunities, challenges, where you want your career to go, and how to best get there. And the fellowship, again, provides a network of people to continue to lean on in addition to your cohort. So as Alden's name comes up a lot, he was also part of my gateway to the fellowship, a friend of a friend. We have a mutual friend. And when I was considering the fellowship, I too called Alden and was like, should I do this? And he was like, absolutely, it's going to be the best year of your life. And it lived up to that expectation. Jackie, you can go to the next slide. And so, as I mentioned, the work continues. And so while it is a phenomenal year, we know that we have to go back out into the world and do whatever the work is that brought us into the fellowship. And for a lot of us, we might go to places where we don't have the same camaraderie and support. And we are trying to figure out how to make changes in places that don't often want to be changed. And so the Reed Scholars serves a couple roles. One, we continue to be a network for each other so that we can be that support, we can be that safety net, we can post job advertisements, we can share family news, we can share our publications and our nominations to different positions and organizations. But it also allows us to mentor the current fellows. We do that every year. And one of the things that we do is have there's lots of great things that came out of the pandemic, but one of them is our quarterly social hours that we do during the year so that the current fellows have even more exposure to the alumni fellows, but they also get to meet them now back in person through speaking events at the different courses throughout the year. Our signature events as an organization are the Health Equity Symposium, which we have every year in May in conjunction with the annual meeting. And that gives us a chance to showcase a health equity topic that we feel like is significant to share with not just our other Reed Scholars and the current fellows, but also the community at large. Again, as feeding back into ourselves, we have our annual leadership retreat each year in the spring. Again, helping to build the organization overall, but it also gives us an additional chance to network and build with one another. And of course, we meet throughout the year. In 2019, we launched the Reed Scholars Live, which is an interactive health equity podcast. One of the reasons that we wanted to do that was to make health equity conversations everyday conversations. And so we wanted to speak with people who are working in the health equity landscape across the board. So we talked to health equity experts in the academic arena, but also those who are doing health equity work at the grassroots level, and help share their story, inspire people on how to get involved, and recognize that, like I said, health equity is an everyday conversation and impacts every part of our everyday lives, and that we need to treat it that way in order to make change. And so just sharing a little bit about who we are, what we do, that we do consider you part of the family. We do hope and expect that you will continue your journey with us even past graduation. This is just not a one-year investment. This is an investment in a lifelong fellowship and learning process. We offer to answer any questions as well if you have them about what we do and how we interact with the fellows during the year and post. So again, thank you all for joining and for your interest. And with that, I will turn it over to the next person.
Next, we have Dr. Alden Landry, who you've heard everyone talk about in terms of his role with the fellowship. He's an associate professor here at Harvard Medical School and assistant dean here, but he is also the associate director of the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. Alden?
Thank you, Dr. Reed, for the introduction, and thank you to my other panelists for mentioning my name a few times. I think one of the reasons why it's fairly common for me to get phone calls and field conversations from individuals who are interested in the fellowship is because of what it represents. And it represents a change in the trajectory that individuals in medicine typically take, right? We're on this path where we go from undergrad to medical school to residency to clinical fellowships, and we have an expectation that we're going to move on to the practice of medicine. And I think for a lot of us, this is really just a time of both reflection and also a time for career pivots. And many of the fellows that have spoken when they called me and wanted to talk about the fellowship, one of the things that sort of comes up in the conversation frequently is that discomfort that comes with knowing that you may be stepping out of the comfort zone, and also the typical path that a physician typically pursues after the residency or fellowship clinical training. And so in these conversations, one of the things that I ask is, what are you looking for from a career, and thinking about long-term or where individuals want to be. And I think Dr. Reed's slide earlier, which showed where the fellows are and what the fellows have done, a lot of their career growth and their trajectory is because they were willing to have that 1 year where they were unsettled and they were uncomfortable and they had to think about and reflect on their careers and their goals, and as opposed to doing what was typically planned or expected of them in their pursuit of a career or practice in medicine. So if you're considering this year, recognize that this is going to be a time of deep reflection. It's going to be a time where you struggle with next steps. And I think there's oftentimes, even a year or two afterwards, the fellows are still wrestling with the combination of the knowledge, experience, and skills that they gained during the fellowship, and how that goes alongside with their clinical practice of medicine. And oftentimes it leads to many individuals walking away from their clinical practice of medicine because they are exposed to other opportunities or the interests, or they recognize that they can be more impactful in the space of health equity and health policy outside of the practice of medicine. I also am a fellow. It was a transformative time for me. It helped me to realize that the practice of emergency medicine was only one aspect of my identity, my professional identity, and my professional growth really was going to be in a place where I can advocate for others, specifically when it comes to access to emergency care, but also the education in medicine, and thinking about that along the entire spectrum from the pre-medical phase to the undergraduate medical phase, and all the way through graduate medical education and continuing medical education. And so I found a space and a place in those paths, thanks to the fellowship. The fellows, my previous presenters, have also talked about the relationships and the bonds that you have with your co-fellows. It's an amazing experience to get to know not only my cohort of fellows, but each cohort that has come after, and also the fellows that have come before me. The levels of mentorship that have been extended to me from individuals such as Lenny Lopez, who is a past alum of the fellowship, Joe Betancourt, who is the president of the Commonwealth Fund, but also a dear friend of mine and a mentor, Roderick King, as well as my co-fellows who I keep in contact almost regularly, as well as many of the current fellows or fellows that have recently graduated who still keep in contact with me, whether it's personal updates about what's going on with them, as well as professional questions and thinking about and helping them with their next steps in their careers. We recently had a fellow who left a job here at the Boston Public Health Commission to accept a role at a medical school. And again, she was wrestling with that opportunity because it was a change in her career trajectory and a new opportunity in a new place. And through those conversations, through the mentorship, she ultimately came to a decision that was going to be best for her and also going to be best for the communities that she's ultimately going to serve as she makes her transition to her new role at the medical school. So with that, I will stop because I think the most important part of this discussion is really the opportunity for us to answer questions. So please take advantage of the Q&A, and I will turn it back over to you, Joan, so you can moderate the Q&A.
Thank you. Thank you to all four of you for your comments and for your willingness to share your journey and your perspective on the fellowship program. As I look at part of the Q&A, I want to go to a first question that came in that was really about, are we sharing our slides and how can individuals get this information? This is being recorded and it will be posted on the Commonwealth Fund site. And there was also some questions in there about how we could connect, individuals could connect with other alums, and had questions specifically about the program. The contact information was on a slide, but the fellowship office is 617-432-2922. Jackie Wright is available to help guide you to other fellows too. So if you have specific questions, you could actually look on the website and see the alums of the program and see if there are any in particular with whom you'd like to connect. And from the School of Public Health, and Achapinti is the person who would be able to talk to you a little bit about the courses that are offered at the School of Public Health. One of the questions that individuals often have, and as when you alluded to it, going from being an attending to being a fellow and the change in salary with that. Can any of you talk a little bit about being in Boston or being a fellow? Some come from residency into fellowship, come from being attending into fellowship, but that other part of living in this area, and how did you navigate that path? Any of you?
I can say, because it was a little easy for me because I had been in Boston since 2015 and then I moved to DC for a year. But it's really such an awesome year because it's the first time you don't have clinical responsibilities. You're not on call. Every holiday is off. Every weekend is off. And most of our classes are Monday through Thursday, unless you're a gunner and you took a Friday class. And so you had 3-day weekends, and it was just time for you to take care of yourself, go to therapy if you need to go to therapy, figure out what you want to do with your life and decompress. And then most of my classmates I'm still close with. Again, Zarita and I are super close. Nora, one of my classmates, is actually here at the Brigham with me. They didn't give her an office yet, so she was actually sitting in my office yesterday, and we were working together and just catching up. And so these are going to be your friends for a really long time. And I only graduated in May or June, and these relationships feel like they're going to be for a long time. And you have time to do stuff in Boston. I mean, if you're from somewhere in the South, yes, the weather here is not great, but Boston isn't like other cities. It doesn't shut down in the winter. There's always something to do. So I just thought it was an awesome year to finally figure out what I want to do when I grow up.
Others? Some of you actually have families too, Alden. You've been in Boston and raised a family, so.
Yeah, I'll try and tackle this conversation. I know there's another sort of underlying question that many people watching the webinar may have as well. First off, Boston is a relatively expensive city, but can you afford to live in Boston on the current salary? Yes, I think you have to be thoughtful about how you approach where you live. And what your housing arrangements may be. If this is going to be a temporary transition for you to come up to Boston and then go back to wherever you're from, there's housing that's available through the School of Public Health. It's a relatively small amount of housing, but that is an option that you could consider. There's other ways that you can find affordable, safe, comfortable living arrangements that are close to the school that allow you to participate fully in the activities of the fellowship. As well as to just enjoy your time in and around Boston, as Nazarene had just mentioned. I think one of the things that people often wrestle with is, I'm taking that time off a year from the practice of medicine. Is this something that I can do? And I think the question is, where are you from a skill set? Where are you as in your training, and how much of the practice of medicine do you need in order to be fulfilled from that perspective, but then also from a financial perspective. There are some fellows that have moonlighted or kept their licenses back at their home institutions while they have done the fellowship. I think the best approach to the fellowship is to be fully invested in the time that you're here and take this time to really decompress and step away from the practice of medicine and be a fully invested learner and fellow in the fellowship. But there are opportunities that you can pursue on your own to a small degree, as long as they don't conflict with the fellowship expectations, where you can continue the practice of medicine and partially fund and support yourself from a salary perspective if you're going to do the fellowship.
Alton, while you're doing that, can you just touch on the issue of moonlighting? Because it's been done in different ways by different individuals.
Yeah, I mean, I think, as I mentioned, some people have kept their licenses at their home institution and have gone back during the breaks and practice clinically. I think other individuals have figured out creative ways to keep their practice going. Some people have found opportunities here within Massachusetts. As you know, we have a plethora of hospitals. And so if that's something that you're interested in doing, you can find a locums opportunity, or you can practice clinically. Again, it's a matter of recognizing the balance and how you want to organize your time and making sure that you're getting the full experience of being a fellow, as opposed to trying to balance those competing interests. I think people need to also think about what other costs may come along with this, whether it be insurance or licensing, things along those lines that you have to consider as well. It's very much a personal decision, personal choice. But I think in the fellows who are here on this call can speak about this. I know, Mary, you can speak about this quite well. There is true value in just being invested in the fellowship and taking a step away. But, you know, we recognize that everybody's coming from different financial needs and financial experiences, whether they have a family that they're trying to support, or, you know, the massive debts that you may be trying to pay off while you're after your medical education. But think about this from what do you want out of this year, and will it compete with will practicing medicine compete with your ability to be fully invested in the fellowship?
You know, Mary, if you could answer that, but also if I look at part of the questions that have come in really in this space about the journey or path that fellows follow. So some are asking about, in other words, as Nazreen has talked about her not-for-profit, do I have to figure this all out before I get there? But I'm thinking about what you're doing with your startup. But maybe because you are so close to all of the alums, so to speak to the kind of journey or path that individuals follow. There's also a question about what happens to the individuals who do an MPA. So maybe you can give your perspective as the leader of the Reed Scholars.
Sure. So I came straight from residency. And actually, moving to Boston was a pay increase for me. So I didn't have it was any which way. I will say the thing I was most scared about actually moving to Boston was the cold. But I learned to layer. I lived in Roxbury, so that was a little bit further from the school, but a little bit more affordable. But the public transportation is amazing, so I could also still walk. I was still just a mile and a half away from the school. So I think it's plenty of options as far as moving and being affordable. Just to Alden's point, be mindful, know what your priorities are, and kind of stay true to that. The second thing I would say around taking a year off, I absolutely agree. I think you should take the year off. I'm an OBGYN. I was worried about my surgical skills, but I didn't miss a beat after the year. And when I went back to clinical practice, I was able to be boarded with no issue. So I would, again, to echo Alden's point, it depends on where your clinical skills are when you come in. I was confident and sound in mind, and so taking the year off didn't jeopardize my skill level or my ability to be boarded when I left. I think third, about the trajectory, it can be almost anything. I mean, so you've heard those of us who come in right after residency, those have come in a few years after residency. We also have had people come in 20 years after our residency or their dental training. And so I think you can do as much or as little afterwards as you need to, because sometimes because you do get so much in the year, sometimes you need a little bit of time to decompress, figure out what you've learned, what you want to do with it, and how to shape your career from there. As I mentioned, for me, I really wanted to be boarded, and I wanted to be clinically excellent, if you will. And so I went back into clinical practice for 4 years and figured out how to do some things on the side to keep my health equity palette wet, if you will, until I was ready to venture out into the world and as Dr. Reed mentioned, eventually land up in the startup opportunity, which is not something I could have imagined, but something I felt prepared for because of the training that I've had and the connections that I've made and the opportunities that have been available to get me here. There are those of us who do still, who went back to clinical practice. There are people who do half and half, definitely people who are still in academics and do research in the area. And then also those from the slide Dr. Reed showed who ventured into government, into the healthcare payer space, who are doing phenomenal jobs leading career paths that seem less than the non-traditional, and some even feel like are going to the other side. Sometimes you hear that as well, but we have to tackle health equity from all aspects. And so the idea that we've grown from 3 fellows in 1996 to this whole cadre of people who are influencing change across the board is phenomenal, and we continue to do so with our recent and current graduates. So I think the sky's the limit. I think however you get there is okay, and there's going to be lots of turns and unexpected opportunities that you might not even be able to imagine when you're in the fellowship, but you'll be prepared for it when you get there.
Thank you. Just looking at some of the other questions and also looking at the time, there's one about family. Yes, there's individuals who've come into the fellowship with children as they come. There's individuals who come to the fellowship who all of a sudden have children while they're a fellow or closely after the fellowship. It's really across the board. There are questions, and Mary just alluded to part of that, people who come in right after residency or another fellowship, and individuals who've been out in practice for 20 years or longer who come to the fellowship because it's the right time in their career. So I think the major point in this is there's the course content, there's the courses for the MPH, the MPA, there are the fellowship activities, but there is not a template of this is what someone's supposed to do with their career. This is a program for individuals to figure out who they are, where they want to go, and then to chart their own course, but to have a whole community to support them and to have their back and be the wind behind them as they move forward. But it is their course. There's another question in there about deliverables beyond the MPH and MPA, and I mentioned the practicum project. There's a practicum required of as part of the fellowship. I actually really want to turn to Nana to deal with 2 of the questions that came up, and I'm looking at the time. And one was around, is there mentoring available in different places? And another part of the question is, what might someone do to prepare themselves to apply for the fellowship? And as someone who's just started it, how did you think about the process, or what do you think people should think about as they're applying? And is mentoring available?
Mentoring is a very key function of the fellowship. There's both structured and informal ways to receive mentoring. Everyone is just an email or a phone call away. You're part of the Commonwealth Fund Fellowship family, and they do truly mean that. There are people that I've just reached out to and said, hey, I'm a current fellow. I'd love to talk to you about your career trajectory. And we've gotten coffee and had meetings. And I think that's why having the time, the unstructured time, and taking the full year and kind of taking a time off is important, so that you can continue to build and network, which is an extreme benefit of the program, because oftentimes when you're working clinically, you don't have time to do that. Formally, you have meetings with Dr. Reed individually and grouped, as well as you have both a sponsor mentor, a peer alumni mentor, as well as 2 peer alumni mentors, one that's a little further out from the fellowship and one that's a recent graduate. And so you meet with them every 1 to 2 months and kind of talk about whatever you would like to talk about. And my mentors really focus on my practicum, what I should be getting out of it, as well as how to kind of structure my year so that I can leverage as much as I can out of the year, excuse me. And with regards to preparing yourself for the application process, I think the biggest thing is standing firm in who you are and being genuine. What is your story? What do you want to do? I think the biggest thing is being able to clearly understand why you feel the fellowship would actually be helpful for your career. I think it's really important to do as what you're already doing, getting more information about the fellowship, being able to talk to former fellows and alums about what they learned from the fellowship, and really focusing not just on the degree. The degree is a part of the fellowship, but it is not a central part. It's obviously really great. I'm loving my MPH year as well, but the fellowship particularly is, why do you really want to make a change in your career? What do you want to do in the space of health equity? And why do you feel the fellowship would help you achieve those goals? So I think really focusing on that and structuring your responses to the essays, your personal statement will really allow you to really shine in your application.
Thank you. I think that the important part there is this is a year about you. And so being honest and true to who you are and why you want to participate in the fellowship. And understand that it's not meant to be a program to earn a degree, although the degree is a part of it. It is actually setting you up for you to be that kind of change agent or change person that you'd like to be. And so as I think about the Reed Scholars and the work that Mary and others have done, you're building connections that you will keep for years to come. For many of them, more than 20 years, as Alden talks about Joe Betancourt, who was in the second class. And I think Alden, you were in the class of like 2010 or something like that. And so that keeps coming back. Please reach out to us. You have the email. You have the phone number if you have questions, if you want to connect with any of the alums that are from the program, and consider us. Consider the MPH through the Harvard Chan School of Public Health, or the MPA through the Kennedy School. I saw some of the questions in the chat. The mid-career program at the Kennedy School. Yes, if you already have an MPH, that is the one that you are eligible for. And for the TH Chan, we only do the policy and the management tracks. Those are the only ones that are eligible for the fellowship program. Thank you for joining us today. I hope you got part of the information that you were looking for. I want to thank Alden. I want to thank Nana. I want to thank Nazreen. I want to thank Mary. I want to thank the Commonwealth Fund, the members of our team in office, Jackie and Ying, who helped to make this program happen. And thank all of you for being with us today. Thank you. Bye-bye.